Hello, how are you guys doing? This is Josue with Breakaway Chiropractic. Today we're going to go over chronic or acute neck, either pain, exercise that can relieve the pain, stretches that can help with tightness and all that stuff. So this is the first exercise that we teach on your first day here. The first thing that we're going to do is going to be some neck stretches. I can show you some, and then Dr. Hash will also demonstrate some. So neck stretches, we're going to bring one hand behind your back. If we have shoulder pain, you can sit on your hand, but what you're gonna do to add just a little bit of extra stretch, you're gonna pull away from your shoulder, feeling that stretch here on the side of the neck. We're gonna hold for 10 or 15 seconds. After a little bit, when you get to those 10 or 15 seconds, we're going to bring your head down as well, still tilted. You're gonna bring them down. You're gonna feel that stretch on the back of the neck. Same thing, 10 or 15 seconds. After that's done, we're gonna go up 10 or 15 seconds, and you should feel that coming here as well, 10 or 15 seconds. And then we're gonna switch sides. We'll do the same thing, so we'll do side, and then we're gonna go down, and we would go up. All of those for 10 or 15 seconds. Repeat 2 or 3 times throughout the day, and that should help a lot. The other one that I like to teach, interlocking your fingers, reaching out, and then you're going to bring your chin down to your chest. You should feel that stretch coming through your shoulder blades from your neck, just to open up those back muscles. Next thing we're gonna do, Dr. Hash is gonna demonstrate chin tuck head lifts. So we're gonna have Dr. Hash lay on his back. And what we're gonna do is 2 motion exercise. So we're gonna bring your chin to your chest. You're gonna make kind of like a double chin. We're gonna pick up your head off the table, just a little bit, enough to get your muscles fired up. We don't want to curl. So Doc, if you want to curl your neck a little bit too much, that's not good enough. We want it a little bit lower just to activate those muscles. If not, if you're going all the way up, you're activating other muscles. Next exercise we're going to do, we call them head retraction. So just in the same position the Doc is laying down, we're going to press the head down into the table. Hold it for like 2 seconds and then release. Very good. You'll see, if you want to keep doing a few reps, Doc, you'll see that he's not moving his chin up or down. He's keeping his neck stable, and then we're just pressing into the table. At home, you can press against your pillow or against your bed. 3 sets of 10. Same thing as the chin tuck head lifts, 3 sets of 10 for the first few days, and then we can increase the reps.
Okay, one more that we can do for neck and upper back pain is we're gonna do scap retraction. So what a scap retraction is we're pulling our shoulder blades back and then we are relaxing. Pulling our shoulder blades back like we're trying to squeeze right through the middle of our shoulder blades and relax. We are not pulling from our traps. We're not doing this, okay? We're pulling back, hold for 2 to 3 seconds, relax. Pull back, hold for 2 to 3 seconds, and relax. The biggest part about this exercise is we are trying to strengthen those rhomboid muscles. Most people are trap dominant these days, especially posturally. We're like this a lot, especially when we're working on a computer where we're meant to be here. Most people get into this position. As we become trap dominant, it starts to lead to a lot of neck tension and pain that everyone feels. So a lot of that pain that we're feeling back through here into the posterior scalenes, and then also in the sides and the middle scalenes, and then the front in the anterior scalenes, which are part of the reason why we do those exercises at the beginning as well. So the next thing we're gonna go to is low back pain. So stiffness, numbness, tingling, just soreness, tightness, whatever it is. There's a few stretches that we're going to start with. So first one that we're going to start is we're going to start off at the edge of the table. We're going to put our leg up and over. We're going to grab from our knee and we're going to pull. We're going to pull our knee to our opposite chest. So right here, you're going to feel that stretch coming into that glute. We're going to hold that for about 15 to 20 seconds, and we're going to do that 3 times. Eventually, you can work yourself up to 3 sets of 30 seconds. The next one that we're going to do is we're going to push downward, because that's going to open up the front of the hip right through here. So same thing, 3 sets. We're going to go 20 to 30 seconds. After you're going to do the other side, you're obviously going to get to the other side. Okay, so once again, bend, opposite knee, opposite chest. We want to sit nice and straight. We don't want to slouch because it's going to put more pressure onto the lower disc. We want to sit nice and straight through here. And then we're going to push down. Okay, once we're done with those, we're gonna get into a hamstring stretch. So we're gonna put our leg out down to our heel, and we're gonna hinge from our hips just like this. Because when we do this, you can already feel that stretch right here. We're not gonna break that posture of our back because it's gonna put more strain. We're literally gonna act like we have a rod right through our hips, and we are going to hinge forward. Okay, so you're gonna feel that down through here, and then we're gonna switch sides. Once again, we're going to hinge forward. 3 sets, 20 to 30 seconds on each side. All right. Next one we're going to get into is tilts and bridges. So we're going to lay on our back. We're going to have our knees up and bent right through here. The whole point of this exercise is to tilt our hips, okay? We're going to tilt and we're going to relax. We're going to tilt. We're going to hold for about 2 to 3 seconds, and then we're going to relax. You'll feel like you're pushing down your low back into the table and you're rotating your hips. Okay, we're going to try to work our way up to 3 sets of 20. Start off at 3 sets of 10 and work your way up. Second one we're going to get into is called a bridge. So we're going to push from our heels and our midfoot. We're going to push up. We're going to squeeze our glutes. Hold for a second. Come down, completely relax. We're gonna push up, squeeze through our glutes and our abdomen, and back down. Once again, start off with 3 sets of 10, and then work yourself up to 3 sets of 20 to get that endurance phase in there. All right, next one we're gonna do is gonna be glute extension. So we're gonna lay face down, okay? Right through here. And what we're gonna do is we're gonna lift this leg up. But we're not lifting from our back, we're gonna lift from our glute right here, okay? So we're gonna stabilize our core, and we're gonna lift. Really squeeze through your glute, hold for about 2 to 3 seconds, come down, completely relax. We're gonna engage, lift, come down, relax. If you notice, I keep my hips flat on the ground right through here. I'm not lifting like this. I'm engaged and keeping everything grounded, and then I'm lifting. So 3 sets of 10, work yourself up to 3 sets of 20. We're gonna do both sides. Engage, and back down. Engage, and back down. So these are the sets of exercises that we do on our first day with patients. If you're doing them at home, please follow the directions and make sure we're doing them for anywhere from 3 sets to 10 to 15 seconds and work your way up to 20 to 30 seconds. Don't overdo it. And if you try to do these exercises 3 to 5 times a week, they will help take a lot of pressure off of what you're dealing with. If anyone's dealing with numbness and tingling and things like that, then obviously you're going to need a little bit more exercise and also different care for that. So please be sure to like, subscribe to our channel, and if you guys have any other questions about anything, please let us know.